it is surgery. If they are performing any surgery on my ear, then it will come to surgery part. Okay, am I audible?
Yes, sir.
One. So I'll start sharing my screen. If any connectivity issue, na, please let me know. Okay. Minute, then we are done. So the similar way, whatever organ system we have, eyes, ear, nose, throat, lung, heart, skin, for every organ system, non-surgical things are included in a medicine chapter. And that's the reason it will take a little time. Okay? All the topics here is not at all related with each other. It means what we are discussing today, it will not be related to tomorrow. Because today we will discuss some other topic. Means in the same chapter, we will discussing. We'll start with the immunization. Okay, immunization and psychotherapy. That is the two things we are going to cover today. Tomorrow we will go to the renal disease, kidney, dialysis. Fine. So like this, we have a different topic in this chapter. So this is the one good thing that it's not. But the thing is, it's a very little challenging topic equally. You cannot say, I remember the topic, I remember the concept from the last class, why it is not going to applicate, why it is not applicable here.
ಮೊನ್ನೆ ಏನು ಮಾಡಿದ್ದೆ ಮೈಕ್ರೋಫೋನ್ ಇದು ಆಫ್ ಮಾಡಿಬಿಟ್ಟಿದ್ದೆ. ಇದು ಹೊರಗಿಂದ ಆಫ್ ಒಂದು ಎಲ್ಲ ವಿಡಿಯೋ ಒಂದು ಆಗ್ತಿತ್ತು.
My screen is visible, guys?
Yes, sir.
No.
ಇದಾರೆ ಮಗ ಹೋಣ.
So in this topic, we are going to cover these many things. Okay? Immunization, psychiatry, dialysis, ophthalmology, audio function test, cardiovascular, and so on. Okay. So this is starting from the 90 series. Okay. First thing what we need to know about this one, that 51 modifier we cannot code on this topic, especially for today's class. Okay. In the immunoglobulin and immunization, we cannot code 51 modifier. That is there in your chapter. This is in a here. Modifier 51 should not be reported. Can you all see what is 51 modifier? Where you will see about 51 modifier. Come to modifier list. Where is the modifier list? First page of your book. Just turn the index in the cover page. First cover page. Turn just there. Left side. Turn the cover page and the next page, left hand side, you will see modifier list. Everyone got that one? 51 is a multiple procedure. Very good. 1 minute now.
Now, so 51 is for multiple procedure. Correct? Now, what is a multiple procedure? See, modifier we know that is giving some additional information. Okay. So, if we are adding 51 modifier with CPT, and always remember, to add 51 modifier we need 2 CPT, right? 2 CPT. How I will say this chair is different than this chair, or I'll say, okay, we'll have a party today, okay, or I like sweets, chalo. For example, I like sweets. You'll say, okay, I'll bring you sweets something. I'll bring you some sweets to you. You bring only one type of sweet. I cannot say multiple now, right? Although it's a multiple, you have bring only this rasmalai or something. Now I'll say, this is one type of sweet. But if you are giving me one rasmalai sweet, then kaju katli, then gulab jamun, then so many other things, I can see this is multiple now. Correct? Similar way, if you want to add a 51 modifier, there should be at least 2 CPT. Then only we can say, now this is multiple, right? So here, although we are using 2 CPTs, but we will not add 51 modifier. Why so? Why we are not adding? Okay, there also one logic. Okay, adding 51 modifier, it means we are telling insurance people that they have done multiple procedure. Here, we are adding 2 different codes, but that does not say that we have a multiple. Here, that will be a part of the coding system. Okay, like if I say, okay, if you are going to any restaurant, okay, and you ordered one thali, one meal. In the meal box, you have a different things. Will you say that is a different item, or you will say one meal? It's a one meal, right? It will be considered as one meal, not different items. Because on that meal box, you have a different things. If you're ordering pizza, along with pizza, they will give you some chili flakes and all. Definitely, you'll not say, this is 2 different things. It's the same thing, right? It needed 2 things at least, actually. If you are ordering meal box, it needs multiple things. Then only you can say that is meal box. Otherwise, you will only order one curry. Correct? Similar way, here also we need 2 types of a code by default. Okay? That is why we are not adding 51 modifier. So one thing you need to remember, no 51 modifier. Any question if you are seeing with, or any options if you are seeing same medicine chapter code with 91 modifier, eliminated. Okay. One more thing, on the modifier list, come to modifier list, write down modifier list, first page.
We can't multiple.
Write down there, 51 modifier cannot be coded along with add-on codes. So first page. There. 51 modifier cannot be coded along with add-on codes. Now I'm not talking about any specific chapter specific add-on code. In all chapter add-on code, you can write down on the top of the book. In all chapter, any add-on code, you cannot add 51 modifier. That is basic rule of 51 modifier. Okay, guys? Good? Good. Great. Why so? Why we cannot add? Because 51 modifier itself says this is multiple. Right? If I mask or one pimple, if I want to remove one pimple, one code. If I want to remove 2 pimple, I have add-on code. So whenever I am adding number of pimples, I can add add-on code. Okay? It makes so, like in a burn case anesthesia we have seen, and a percentage, if you are increasing percentage, the number of codes will be increased into 1, into 2, into 3. So by default it's a multiple one. So you cannot use add-on codes. You cannot use 51 modifier on add-on code. Okay, that will be your basic rule for add-on code or for 51 modifier. So now what we are going to see? We are going to see immunoglobulin serum or recombinant products code. What are those products? These are some injection which is for our immune system, which can boost up our immunity or which can work on our immune system. Okay, it will give you little like immunoglobulin. First code 90281. Okay, it is immunoglobulin. If you have read little bit immunology, there are many different types of immunoglobulin we have. Okay, some is formed in our body, some we have to take from outside. Okay. Like in this product, IG, it's immunoglobulin. Human means it is derived in a human. Second one for intramuscular use. So now, if you see one thing, I'll just show you. See this diagram. We have a different routes of injection. I cannot say I'm going for injection and there is only one type of injection. There are multiple routes of injection. Some injection, most of the injection what we get is a intravenous. In vein, there are intra-arterial, there are intramuscular, in a muscle, there are subcutaneous, there is intradermal. Subcutaneous means skin, intradermal means just below to your skin. Intramuscle means they will give in the muscle. Okay, so if one product, now 90281 is a product code. 90281 is a product code. This one product is designed for only intramuscular use, intramuscular injection. Can I give it intravenous? No, na? But monkey can climb on the tree, not elephant, right? They are designed for separate thing. Similar way here also, products are designed. They clearly said it's a intramuscular use. So you have to use only for intramuscular. That is one thing clear. Here we have very few concepts, but it's a very general concept. You all will remember the concept. I'll assure you. This is one code, one product. It means if you are using this code for a person or in a report, in a medical record, you are giving money for this product code. Now, so in general, suppose I am going to a doctor today. Doctor said, Vinay, you are so weak. You have to come every day for injection. Or vitamin D deficiency. You know what vitamin D? That is for our bone strength, right? If you have a vitamin D or anyone have a vitamin D, they have to take injections of vitamin D. Okay. So suppose today I was diagnosed with the vitamin D deficiency. Okay. Now doctor said, Vinay, every week you have to come for injection for next 4 weeks. I said, okay, doctor. Then I asked, doctor, how much it will be? So he will say, see, 500 rupees for injection product and 200 my charge. I have to give injection, na? Doctor is going to give injection. So 200 is my charge, 700 you have to pay. I said, okay, doctor, it's fine. Today I went, he charged me 700 rupees because 500 for drug, this vitamin D product, and 200 his charge. Okay, 700 I paid. Now, I got one medical store where they are giving me some offer. They said, sir, if you want this 500 rupees wala product, I will give you a 400, but you have to buy at least 2. I said, I will buy 3 because I need 3 more injections, right? So I paid 400 rupees for each product. I bought 3 products. Okay, I can store in my fridge. Next week I am going to doctor with my product.
Now how much I have to pay to doctor? You understood question? Now I have my own product. Doctor will give me injection only. Now how much doctor is going to pay me? How much I have to pay to doctor? How doctor will pay me?
200.
200 only, right? Why so? Because of procedure.
Service charge.
Correct. For injection. So we have two things here. One product, one procedure. Okay? One product which I bought and second procedure. For that I have to pay to doctor. Similar way for immunoglobulin also two things. One product code, what we have seen, it means if you get a report, a medical record for this, you have to go two codes. One product code, one procedure code. So these all are product code 90281, 90283, 90284. Okay. On the next page also we have so many other codes. You can see on that page. We have a different product code. Right? Now the procedure code, the injection code. Where it is there in the same chapter, and you can see the paragraph here. Code 90281 to 90399 identifies the serum globulin extracted from the human blood or recombinant immunoglobulin products created in a laboratory through the genetic modification of human and or animal protein. This all are reported in addition to administration code. Administration code means procedure code. What are the procedure codes? 96365, 96366, 67, 68, 69, 70, 71, 72, 74, 75. Please highlight that line. Those are product code. Procedure code. Those all are procedure code. It means you have to code two types of code. So what I will suggest, write down on the top of your book, write down, always code two types of code. And you know now what are the types, one product, one procedure. Now see, I am coming back on that. We are coding two types of code, one product and one procedure. Logically, we have to use 51 modifier, but here they are saying no, we can't. That is why we cannot, because this procedure itself says we have to code two to code. Okay, that is why we are not adding 51 modifier. If there is no guideline, we have to code. See one question. This is very non-important things. Okay, there's one topic. The important thing is vaccination. Okay, human immunoglobulin for intramuscular use. This is one question, one line question. Now you have to code two types of code, right? So A and B option you can eliminate. Why you can eliminate?
There is only one code.
Correct. Only one code. Very good. Now A and B eliminated. Now you can see we have two options C and D. In both that we have two to code. 90281 and 90283 is a product code, and 96372, 96372 is a procedure code. So 96372 is a common. It means it's an intramuscular injection. Now can you check 81 and 83? Which one will be correct answer? Yes?
81.
81, because 81 says in intramuscular use. What is 83? Intravenous use. Correct? So I cannot call elephant to climb on the tree. Right? Intravenous product cannot be administered by intramuscular. Right? It's like an eye drop you are eating. Nothing, no use. You will say, I'll give you, hey, this is eye drop, just drink it. It will not use what? This is medicine. Nahi, everything have their own rule. Right? Like if you see any cosmetics, okay, creams, lotion, what they mention in a Vaseline also, what they mention for external use only. Very good. Second question, can you see? Human immunoglobulin for intravenous use. First two option eliminated, A and B. Now 90281, 96372 and 90283, 96374. You can go with anyone. Means anyone means either you can go with the product code or you can go with the administration code. Correct? So answer will be D. 96374 is a injection procedure code for intravenous use. Patient with a primary immunodeficiency receives the intravenous injection of immune globulin product. What CPT code should be assigned for this service? You can see all options have 22 codes, so you cannot eliminate based on that. All options have the same procedure code, 96374. That is for intravenous injection, right? So you cannot even eliminate based on that. Now, but you can see 902, 83, 84, 81, 87. Go with each code, find out what is the correct answer. Don't look at this highlighted one. Correct. So here also 83 is for intravenous injection. What is 84? Subcutaneous. 81 is a intramuscular. What is 287? Any route. But what is the description of the 87? 90287? Antitoxin. This is not antitoxin, na? Correct. So now it is clear? Everyone?
Yes, sir.
You need to remember only two things. One, always two types of a code. Second, no 51 modifier. That's all. This is that much easy. You can see 81, 83, 84 is only for immunoglobulin. Then 87, 88 we have a botulism and botulinum antitoxin. Equine is a animal or a horse animal where they have obtained this one botulinum antitoxin. Same way we have a rabies immunoglobulin. Okay, cytomegalovirus immunoglobulin. So you can go with the product and then administration. Okay, this is clear? Okay, just take a minute. If you want to read, you want to highlight anything, please do that. Then we'll start immunization. Okay, take your time, highlight, read. Okay, done? All good? Here, online guys?
Yes, sir.
Good, very good. Chalo. Next, now we are coming to very, very important topic, which is the immunization or vaccination. So earlier, when before COVID, when I was telling this vaccination part, I used to give an example. Oh, in your childhood, you got vaccination and all. After COVID, recently one, you all got vaccination, right? Double or triple? Booster also you got? No, no.
Okay. Vaccination. What it do? Is it for a treatment or for prevention?
Prevention.
Or Okay. If I have a COVID, suppose, if I take vaccination, will it resolve my COVID? So this is not for treatment. It is for prevention. Okay, it is coming under preventive medicine services. See, when why government said that time in 2-3 years back that everyone has to be vaccinated, because they want to prevent COVID, right? This is not for treatment. If patient have treatment, there will be some antiviral drugs, and then we have if it is severe condition, then we can use ventilator and some other things. That is for treatment. So this vaccination will always for prevention. How many types of vaccine we have? Hundreds of types. Too many types. Baby, when the baby born, from that day, it is a continuous process. Every 3 months, baby is born, then 15 days, then 45 days, then 3 months, then 6 months, then 1 year, then 2 years. We have a different vaccine schedule, right? For all the babies. Now, similar way for grown-ups also, we have so much vaccines. Right nowadays we have for more than 60-year age people, we have one type of vaccines which can prevent the few diseases which is only for on the old age. Okay. Now we got COVID vaccine for all the age people, right? So vaccine can be given in any age, right? This vaccine have a multiple types. And what will be the route of vaccine? Will it be only intravenous, only intramuscular, or anything? It may be. Okay. Okay. Chalo. Will it be only injection or any other dose also? Okay. Online guys, you tell me.
Any other dose.
Any dose. How we know? Pulse polio. Right? What is pulse polio? Just 2 drops to kill the polio virus, or not kill the even, to give immunity for that, right? For polio virus. So it can be any dose. So what we learn here, that it may be for any age, it may be for any route, right? And there are multiple types of vaccine. As in general, I'm asking you, this is not related with our course. What is the vaccine? What we have on that? What type of medicines we have on that? Okay, did you, everyone got COVID vaccine? What was there in a COVID vaccine? Don't give me the brand name. Okay, last class give me brand name. I got this Covishield and all name. Not brand name. What was there in that bottle? Tell me, you have that responsibility on your shoulder.
Inactive organism.
Very good. That vaccine which we got, that had COVID virus, but inactivated COVID virus. Okay. So now, first we'll understand how our body works. If you're working in any office, any corporate or any office, any building, yearly once or yearly twice there will be some mock drill for emergency situation, right? Like if our building got fire, or there is an earthquake, or there is any other things, how you are going to escape from that building safely. And then all the buildings, the working place, there is one zone which is called safe assembly zone. Okay, so if there is a fire or something, everyone has to rush to that place. You cannot use elevators, you cannot bring all your systems and all. Okay, like 3 months back, it happens in our office.
I was in a 9th floor. And they suddenly siren, that they have switch on siren, they said, run. I said, okay, well, I run towards the escalator. This lift. They stopped that one. They said, use stairs. I was in 9th floor. Okay, that is also fine. Okay, so why we are doing this? Mock drills, or even all the police or all the forces people also, they do sometimes mock drills, na? Why they do? That if the real incident happens, we will be well prepared. If suppose, unfortunately, my building, my office building caught fire, then I know where to go, how to go, because I have already practiced it. Right? That is called mock drill. Same thing happens in our body. Why we are doing why we are giving vaccine? Just to fool our body. Our body don't know that this is a real vaccine, this is a real virus, or this fake virus. Like once we got COVID injection, COVID vaccine, that was a very small amount of inactivated virus. Inactivated virus means it will not cause COVID. Okay? But its structure is very similar to COVID. Virus is what? Proteins. Okay? So they have removed the activated proteins, and whatever the inactivated proteins, they have made a vaccine. Okay? That's why it took little time to prepare. Right? They were doing research for so long, so that it cannot cause COVID in our body. And what happened? We are going for vaccine. Vaccine only causes COVID. No, not good. So inactivated virus, as it will enter in our body. Okay, it was an intramuscular COVID vaccine. So once it will enter in our body will realize, why there is an attack on our body. We got COVID vaccine, COVID virus. Okay. Then our immune system will say, okay, I will take care of this. He is in charge of the attack, on attack. Now, what they will do? First thing they will do, our immune system, it will increase our body temperature, just to prevent other body organs affected from that virus. First thing. Second thing, it will start increasing the number of WBCs or white blood cells in our blood, so that it can fight with that vaccine virus. Okay. Third one, it will start preparing antidote in our body. Okay. So that is the reason after COVID vaccine, few people got fever for 1-2 days, right? And doctor says if you are getting fever, it's well and good. It's good only, right? It's working actually. Then our WBC count increased. Then our antidote, our immune antidote, it start developing, or it start multiplying. Now we suppose in one dose I administered 10 COVID virus, inactivated COVID virus. Okay. So for that 10 virus, my body prepared 10 or 100 antidote. They are well prepared. Chalo, let it come. We will see that one. Okay, like how we had a college fights and all. Let those other people come. We will see. We have good strength. So the strength of our antibodies. So this is not antigen antibody. Antigen is a foreign body material which entered in our body. To replicate that one, our body will prepare antibody, which will neutralize that COVID virus. Okay. So now my body prepared 100 antibody against antigen. But then they realized that was a fake one. This is not a real one. This is not, or they will first kill that one. Okay, that whatever the inactivated virus we got, they will kill that. We got antibody. Still they have not realized that was a fake one. Then they will see, okay, your job is done. Out 100 people, you can go now. Antibody, you can go now. Your job is done. You already neutralized enemies. But then they will realize, yeah, what happened if in the future we will get the same. So there is a antibody, one type which is known as a memory cells. they will create memory cells. How? They will create the exact memory of a COVID vaccine. And that is why, what do you think? COVID is eliminated? No, it's still there. We all are vaccinated. Because of that, we are not getting COVID. COVID was there before 2020 also. I got few reports when the time when I was I was in a production. Okay, that time I see many people were coming for COVID infection in 2014-15 also in the US. So it was there. It will be there. But the 2020 it was a pandemic. Okay, so now our body, everyone who all got a COVID vaccine, our body have a memory cell. It is there in our body somewhere. Okay, so whenever, suppose now I got COVID virus again from someone, my memory cell will activate. I got the same one. Okay, they will like, I know that virus. They will create antibody. Antibody will neutralize COVID vaccine. Again, the memory cell will be sleeping. So how intelligently our body works. This is memory T cells we have. If we'll go little more deep in immunology, we have different types of T cells. This is how our vaccine works. Yeah? This is out of this extra knowledge. So now what we have here codes. So this is few vaccines. The routes. Percutaneous. Percutaneous. Per means via. Cutaneous means skin. Intramuscular, intradermal, intranasal, oral. Intranasal also we have. See, there are so many vaccine codes. 90476 to 9091315. We have so many vaccine codes. I told you hundreds of codes, hundreds of vaccines we have. Now, one more thing you need to understand in this. Few vaccine is able to fight with one disease. Okay, like polio vaccine. Babies are getting polio drops. That is only and only for polio virus. But there are few vaccines which have a combination. Okay, which have combination to fight with a multiple disease. Like if I say top DTaP, DTaP is small, so DTaP. There are 3 diseases that it can fight. D for can you come to 90700 code? You only tell me what are the disease it can fight with. 90700. Search code. Can you read that code? And tell me what are the 3 conditions or 3 diseases it can fight with. And diphtheria, tetanus, and correct, acellular pertussis. So you can see that. I say I don't know anything about medicine or anything. No, I'm not coming from the BCom background. Then also you can easily find it out. How? Diphtheria, tetanus toxoids, and or cellular pertussis. It means this is called components. Vaccine is one. This is one bottle only. In that one bottle, we have 3 different things. Okay, so this is the 2 terms. One is a vaccine, second one is a toxoid. If I say what's your lunch plan? They'll say I will have biryani today. Okay, biryani is a one dish. But how many components we have there? Rice. If it's a veg biryani, then vegetables. If it's non-veg biryani, then chicken, mutton, whatever it is. Then we have some other things also, right? Masales and other components. So in one dish we have a multiple component. similar way, DTaP is a one vaccine where we have three components. Similar way, come to 90707. How many components are there? Online guys?
3.
Three. Very good. Measles, mumps,
Mumps,
and
rubella.
rubella. Correct? MMRV. Measles, mumps, rubella, and varicella virus. How many components? Very good. Everyone is good with the components and vaccine? Number of component may be equal to number of vaccine or may not be. Like if I say polio vaccine, we have one vaccine, one component, right? Here you can see 90476 adenovirus. 90476. One vaccine, one component, right? One vaccine, one component, single component only we have. (90587). You can see in the slide, dengue vaccine. How many components we have? Only one. One code is for one vaccine. But in that vaccine, how many components we have? Here we have only one component. 90700, you can see diphtheria, tetanus toxoid, and acellular pertussis vaccine. Three components. Right? 90707, measles, mumps, and rubella virus vaccine. Three components. Good? Okay. So, these all are a product code. Here also we have to go two types of code. One product code, one administration code. Two types, okay? It may be more than two numbers, but two types of a code. Okay? Now, or you can write here also. Always code, two types of code. Now you know what are the two types. Code, two types of a code. So we have so many vaccines. Hepatitis B only we have so many. So here also we have product as well as procedure. I'll assure you they are not going to confuse you with the product code. Okay? Product code will be there in every option, maybe same product code. So they are not going to confuse you with the product code. The only confusion is with the procedure. Okay? Because here we have so many procedures code. 6 procedure codes. 90460, 461, 90471, 90472, 90473. Now, who can decide? The only main challenge here is to decide which procedure code you will go and how many you will go. Okay, so for that, just look at this. I have created this 6 procedure code into 2 groups. I have divided these 6 codes into 2 groups. One group is for 90460 and 90461. The second group is for remaining 4 codes, 71, 72, 73, 74. Okay.
So now you have to remember this flow chart, which is not there in your book. I'm going to share this slide to you. Don't worry. So you can later note it down. So first thing what we have to see, patient age. If patient have age less than 18 years. One thing, correct. Second, if it is less than 18, then I need to check whether the counseling has been done or not. Counseling has been provided for that vaccine is not or not. You know counseling, right? They will tell just to about the benefits of the vaccine or any side effect of the vaccine, like how we got in a COVID time. They said, oh, don't worry, you will get little fever. That is also fine. If fever is there for 3 days, then you come back to hospital, right? So that is a part of counseling. Counseling may be verbally, maybe some literature also. They can give you some leaflet, pamphlet, some notes. Read this one about this vaccine. That is also good. You know? So counseling is for any kind of information. If both are yes, age as well as the counseling, both should be yes. Okay. Then we will go with the group 1, which is 90460, 90461. If any one is no or both are no, if age is more than 18 or counseling is not done or both is not correct, then we will go with the group 2, 71, 72, 73, 74. As of now, it is clear. See, if the age is also less than 18 and counseling is no, then also group 2. Okay, everyone, it's good?
Yes, sir.
Oh. Now you will just tell me group 1 or group 2. Okay? Group 1, you know, less than 18 year age and counseling, yes. These two criteria should match. Just show you one. Okay. Just tell me group 1 or group 2. Donna brought her 14th month old baby into the physician for the 12 month immunization. The physician administered the MMR vaccine via subcutaneous injection. Age is less than 18 years, and a 14-month baby. Counseling is done?
No.
No counseling. Group 1 or group 2? Group 2. Very good. Read the question, tell me.
The counseling has been done.
So, group 1 or group 2?
1.
Very good. Because age is also less than 18 years and counseling also done. Group 1 or group 2?
1.
Okay, group 1, correct. Counsel the mother on the risk and benefit. Group 1 or group 2? Group 2.
2.
So now we are good with the grouping, right? Very nice. Now let's discuss about the group 1 first. (90460) group 1 code 460 and 461 are based on number of component. Now you know component also, right? These are based on number of component, not number of vaccine. So if there is 2 component in a single vaccine, we have to code 2 code. Which 2 code? I'll tell you. 90460 is a parent code and 461 is the add-on code. Okay? It does not depend on root because it says any root. Any root is good with this. Okay. So this is based on component. This is not based on root. Okay. Now if I have a MMR, how many components on that? 3.
3.
So how I can code? For first component, parent code. For additional component, add-on codes. So how you will code procedure code for MMR vaccine? 90460 90461 into 2. 3 component, right? So for first MMR. So for first M, it should be 90460. Second M, 90461. Third R, 90461. So how I can code it? 90460, 90461 into 2. Good? Easy, na? So what is your first job? To decide whether it's group 1 or group 2. If it is group 1, let's go with that. MMR 90460, 90461 into 2. Correct? Very good. If it is a group 2, one vaccine intramuscular, then MMR. Suppose MMR they have given no counseling. Intramuscular. How you will code? Group 2, na? So what is the code for that? Intramuscular injection. 90471. Correct. You can see 90471 is for percutaneous, intradermal, subcutaneous, intramuscular, one vaccine. Right? And 90472 is for each additional vaccine. Here vaccine is only one. MMR have one vaccine. 3 components, that is the second part. Right? But vaccine is one only. So this group 2 is based on number of vaccine. We put one code only. If it is group 1, that is based on component. 3 components. 3 codes. So 90471, 90472, these are injection code. And 73, 74 are drops code. See, nasal and oral. So nose and mouth, they will not give injection, obviously. It is a drops. Done? Achha. First, again, group 1 90460. I will read the code description. Okay? We'll try to find out more things in that. It says immunization administration through 18 year, that less than 18 year, right? Through 18 year means up to 18 year only. Of the age via any route. You can highlight any route of administration with counseling. So we know that is counseling also should be done by physician or other qualified healthcare profession. First or only component of each vaccine. Means in one vaccine, first component will be for parenthood. Right? If I'll say a polio virus, polio vaccine has been given for 2 years old baby with counseling. And they have given drops. Group 1 or group 2? Group 1, very good. Any rules, okay? They will give oral drops. You cannot go with the 73, 74. It is group 1. So it is polio vaccine, only one component. What you will go for procedure? Procedure code? Group 1. One code enough now? Correct. For procedure 90460 is enough. Because one component only. Okay. But if you see here, what they say is green color here highlighted. First or only component of each vaccine. It means if there are two vaccines, okay, there are two vaccines, then you have to code it separate. Just one line you can write down on the top of your book, top on your book. Number, everyone, number of vaccine is equal to number of 90460. I'll explain it. This is the most challenging question or interesting one. Number of vaccine is equal to number of components. Come to these questions. Let me give you easier one. What will be answer here? Product code you can eliminate. Okay? You can just ignore that as of now. 90707 is a product code. No one is going to confuse you with that. So this is MMR. Group 1 you told about this. You said, right? What will be the code? 90460, 90461 into 2. Very good. Adenovirus 4. How many components? One. If you if you want to know how many components, simply you can go with the 90476. That is the product code. Okay. By looking that this options only, chalo, if I don't know anything about that, I can eliminate option B. Why so? Because there is only one vaccine. I cannot multiply 90460. I can eliminate option C because that is having only add-on code, no parent code, right? I can eliminate option D also because here counseling is done. That is a group 2 one. So what is the answer then? A. See, no need to search, no need to open book, nothing, right? If you know the concept, see, this is my job for you. I have to tell you concept, and your job is to remember that concept. If you remember those concepts, no need to open book for many questions. Like I know 461 is the add-on code. You cannot code add-on code alone. I need parent code. Parent code is a 460 for this. So eliminate it. There is only one vaccine. How do I know there is only one vaccine? Only one product code now. 90476. If there are two vaccines, there should be two product code. So for one vaccine, only one 90460. B option also eliminated. Now this is a group 1 category. Less than 18-year age patient and counseling has been provided. So group B code or group 2 code 73 will not be my answer. D also cancel. So the answer here will be 90460. One component and one product code. Clear? Now see this. This is, we have group 1, okay, 12-month-old baby, and okay, counseling is not done in the question. Then what will be your answer? Achha, which options you can eliminate? A option you can eliminate, B option you can eliminate, and D. मिल गया आंसर then. C. Right? How easy it is. No need to open book because you know that is a group 2. Here counseling has not been provided. That is why group 2. Achha. Suppose in the same question, if they have given counseling. Now hold, okay? Now you can eliminate option C. Because age is less than 18, counseling provided. Option C eliminated. How many total components are there? MMR how many? 3. DTAP how many? 3. Total 6. So how many total product procedure code I have to code? 6. So D option also you can eliminate. There we have only 2 procedure code, right? 61 is not there. Eliminate. So C and D I have eliminated. Now most of the people, how they do mistake, they will consider, this is 6 1 na? So what I can do? 90460 and 90461 into 5. B option. But that is wrong. Why so wrong? Just now what you wrote down? Number of vaccine is equal to number of number of vaccine is equal to number of 90460. Oh, number of not component, right now. Number of vaccine is equal to number of 90460. Now the best way to crack this type of question, code separate. Both vaccine you can code separate. But why we are coding separate? Because my 90460 description says first or only component for each vaccine. So I have to check each vaccine. Okay? So that is why best way or best trick, code it separate. So MMR how you will code? 90460, 90461 into 2 and product code 707. For DTAP 90460, 90461 into 2, 90700. How, if you will combine both the things, what will be your answer then? 90460 into 2, 90461 into 4, 90700, 90707. Okay, any doubt on this? This is the most interesting question which usually they ask in exam. Why we are doing this? How we are doing this?
Hello.
Yeah.
Great, sir.
Yeah, Kiran.
Can you explain on site this one?
Sorry, what? Repeat.
This topic.
Sure. See, if you will go with the number of components, here we have a 6th component. So most of the people, if they do not know the concept, they will choose option B. Okay, but you cannot choose because you know concept. What is concept? 90460 code, the description says first or only component of each vaccine. Each vaccine, it means here it's a 2 vaccine. You have to code 2 times 90460. So the best way for the beginners, if you just want to know how to do that one, code it separate. You can code 907 MMR separate and you can code DTAP separate, and at the end combine it everything. Okay, 90 MMR you code separate as only if I'm talking only about the procedure code, it will be 90460 and 90461 into 2. Okay. If you want to go with the DTAP, 90460, 90461 into 2. Correct? Now combine it. 90460 into 2 and 90461 into 4. Why we are doing this? This because of that each word and what you just noted down. Number of components, number of vaccine is equal to number of 90460. We have 2 vaccines here, so you have to quote 90460 twice. Then you can say that D option also 2 times. But there is not only two code we have, which is for 2 components, right? Where are remaining 4 components? So that is why the best way to solve this question, go with the individual. Solve based on individual vaccine, and at the end you can combine. Hope so it's clear now. Yeah, good.
Yes, sir.
ಎಫೆಕ್ಟ್ಸ್
Okay, this question.
ಅದು ಹೆಂಗಾಗುತ್ತೆ ಮೇಡಮ್, ಟೈಮ್ ಹಿಡಿಯುತ್ತೆ.
Don't know about group 1 or group 2?
ಹೆಂಗಾಗುತ್ತೆ ಅದು ಎಫೆಕ್ಟ್ಸ್ ಆಗಲ್ಲ ಮೇಡಮ್, ಕಳಿಸಿದಾರಲ್ಲಪ್ಪ ಗ್ರೀನ್ ಟ್ಯಾಗ್ ಹೋಲ್ಡರ್.
2.
Group 2, obviously, right? There is no counseling. 1 vaccine they have given as subcutaneous, and 2 vaccines they have given oral route. Option A or option B? Option A for first subcutaneous 90471, for 2 oral route 90473, parent code, right? Wrong. Okay. Actually, that should be our answer, but you missed to read one guideline below 471 and 473. Do not report 90473 along with 90471. Now these are the 2 parents which the 2 families, different families. They are neighbor, but they do not speak with each other. Okay, right? What we see in our society normally, right? Both are neighbors, but they don't speak with each other. So they cannot sit with each other. But their children, they play with each other. Okay, and they both like each other's children also, no problem. But these 2 parents will not come together. If you'll ask, no, there is a no. If you have any function, take my children. I will not come to your home. Okay, so in such case, you can code 74 along with 71. Now you can say, but why? 74 is the add-on code. Parent code is 71, na? 73. Check 74 down. Code, use 90474 along with 73, 71, 60 also. So, do not highlight that guideline. Do not report 90471 along with 90473. Done? That guideline wala part? Now we are going to one level up for questions. Okay, tell me which options you can eliminate. The best way is eliminating options. Okay, try to eliminate options. You will get at least 2 options. 16-month-old going to the pediatrician or his well child visit, counseling done. MMRV subcutaneously. Group 1, Group 2. Group 1, very good.
Group 1.
Which options you can eliminate then?
B.
Very good. B option eliminated. Very nice. And only one that. Fine. DTaP also we have, no? DTaP and MMRV. So option B eliminated. Now, any one more option you can eliminate? number of vaccine is equal to number of what you wrote down? 2 vaccines here. What you noted down? Number of
C.
Yes.
C you can eliminate because we have 2 vaccines. Logically, if we have 2 vaccines, there must be 290460. So C option also eliminated. Good. See, out of 4 options, 2 options eliminated. 50% question solved now. Only 50% is pending now. Now, check if you can solve. Acha, one more. No need to open book. Now we have A and D. What extra thing you are finding between these two?
51.
Yes. Can we use 51? No. Eligible. Option answer is A. What is 9039225 modifier? That is ENM code. Okay. We'll start ENM. I'll tell you that time. That why we are coding this one, because of this well child examination. And 25 modifier is for ENM code. Whenever you are coding ENM code along with any other chapter code, you have to add 25 modifier. Okay. Good. See how you can solve question. Still you did not open book for this. You know which group, A, 1 or 2. Then you know the concept, number of vaccine is equal to number of 90460. Done. Same question, only the well child exam is not there. What will be answer? First. A. Done. A is answer. A mother arrives at the pediatrician office for the first time with his 2-month-old baby girl. The infant was born at the home and the physician did not have an opportunity to evaluate the infant in the hospital. The physician performed an initial comprehensive preventive medicine examination and administered 1 injection of diphtheria, tetanus, pertussis, DTaP, Haemophilus influenza type B, and inactivated polio vaccine virus via intramuscular route. What is the correct route of that? Which options you can eliminate? Acha, group 1 or group 2? Is it counseling done? That is not a counseling. Examination is different. Examination, they are doing examination for other things. Counseling means they are totally focused on their vaccine. Group 2. So which options you can eliminate?
A and B.
A and B and D. Then answer will be C. His answer is C. Check answer C. Option C. You can choose, eliminate, or choose. She's wrong. Why? 51 modifier. So C you can eliminate, A you can eliminate, B you can eliminate. Why? Because this is not a group 1. And we should not use 51 modifier. So answer will be D here. Do you have any question on this? Read one more time. You should have some question. How many vaccines they are using?
There is a 3 vaccine is there, right?
There are 3 vaccines, no? Then why we are choosing option D, which is having only 1 vaccine procedure code? Can anyone give me answer for this? And option D is correct answer. Why it is correct answer, boss? How do we know this is the 3 vaccine? Because it's DTaP is one vaccine what we have seen, right? HIV is one, IPV is one. But you can see 90698. What is 90698? Product code. Can you check that product code? 90698.
ವಾಯ್ಸ್ ಏನು ಮಾಡ್ತಿದೆ ವಾಯ್ಸ್ ಏನು ಮಾಡ್ತಿದೆ
D and Haemophilus influenza inactivated polio virus vaccine for intramuscular use.
Nine, correct. 90690 is the combo vaccine for everything. Yeah, we know DTaP is a one separate vaccine, but in this 90698, they are combining many different vaccines together. So if they are combining, we will consider the one vaccine only. Vaccine is what? Vaccine is one bottle, one ampule. Okay? So here I can say there are how many components? 3 plus 1, 4 plus 5. In this vaccine, one vaccine we have 5 components. Diphtheria, tetanus, pertussis, influenza type B and polio. These 5 components are there, but the vaccine is only one. How do you know? That because we are using only one product code. Done? All good? This one, which options you can eliminate? Which options you can eliminate? A, very good. Why?
Counseling has been done.
471 is there, correct. Okay. Then, how many vaccines are there? Okay, this is group 1, right? Okay. So, how many vaccines are there? 2 vaccines. So, number of vaccines is equal to number of 90460. So, B option also you can eliminate. C option, I gave you answer only.
D is the answer.
These are the answer. Because it is 2 different vaccine. How do I know this is 2 different vaccine? 2 product code. 90668 and 90621. 2 products code, right? So if it is 2 products code, 2 vaccines, group 1, so 90460 into 2. In none of the options we have the same. See, don't overthink it for. Okay, don't think how many components. Don't need component for this. You act as a exam experiment, not like a coder. Okay, don't be coder for this. You will have 4 options. You have to choose out of that. Good. Don't try to code it. Coding may be a little challenging, but to choose options, that is very easy task. For Medicare patient, we need to code G series code for administration. Because see, what is the Medicare and why we are using G series code. Medicare are the federal policies, or means the government, US government policies for the patients who are over 65-year age, okay, or they have a chronic or lifelong conditions like a disability, like ESRD, end-stage renal disease, or blind. Okay, for these people it is free of cost. So if you remember, our government also in the COVID time, what they have given, if you want to pay for your COVID vaccine, if you are old age, in our grandparents, if we have for our grandparents, if we wish, we can pay. But if you don't want to, pay, it will be free of cost. You just have to give your address proof, age proof, right? For more than 60-year age patient, it happens in a COVID time, because government will say, I will pay for that vaccine. For over 60-year age people, I will pay for that, right? Same thing happens there also. If the patient is Medicare, they'll say, don't take money for that one. Okay, we will pay. So for we will pay, we have a separate code, G series code, G0008, administration of influenza flu virus vaccine, G0009, pneumococcal vaccine, and G0010, hepatitis B vaccine. Okay, so always remember, if it is a Medicare, you have to put G series code. Okay. Now, very interesting, exceptional question. Here, patient have laceration repair. Laceration means cut. Okay, that is called laceration. Repair means stitches. They are marking stitches. Now, along with that, patient is gone through with the vaccination. We know we cannot use 51 modifier vaccines, right? Why so? I gave you reason for that. Because by default, we have to code two types of a medicine code. One product and one procedure code. Here, along with procedure and product code, we are using surgery code also, right? Here, you have to code 51 modifier. Exception code. Exceptional scenario. See, 51, that don't consider that, do not use 51 modifier as a blanket rule. It is not for all the situation. The concept behind that is that we are using multiple codes, right? But here, along with the multiple code, we are using the surgery codes also, which is not included. We don't have a guideline that use surgery codes also, right? So for that condition, you have to use 51 modifier. All good? Here the answer will be D. Or not D, 1 second. 471. 72, see, B will not be your answer because 72 is add-on code. Add-on code we cannot use 51 modifier. Okay. C will not be answer. B and C eliminated. And answer will be A. No need to use 51 modifier on the product code also. Answer here will be A. I will share this one. Remember, the answer is A. This is for you. I'll just share it with you. Okay, done. We have few COVID vaccine codes also. That is apart from our normal vaccination. So this is 0001A, immunization administration for the intramuscular injection of the SARS-CoV-2 COVID-19. First dose, second dose, third dose, booster dose. And the product code is 91300. and 305. So they have not started to ask question for the COVID vaccine because they have plenty much codes there. Okay, what is that one? 0051 immunization COVID vaccine. What is the difference, boss? So it's a severe acute respiratory syndrome. Severe respiratory. What is the difference here? I don't have a book, so I cannot find it out. Tri-sources formulation. Okay. Earlier one, diluted, reconstituted first dose, and here we have a tris sucrose formulation in 0051A. Did you get that code? No? Yes. It must be in a category 3 then. Okay, anyone got that code?
Page number 745, 746.
745. That is the old book. New book. Okay, they deleted in 2025. They have deleted this code. Good one done. They're deleting any code. I'm very happy. Okay, so skip this one then. This all codes has been deleted for 2025. Okay, take 2 minutes. Let me know if you have any doubt on this. Read it, okay, and tell me if you and revise all the scenario. If you want to write something, please write down. You have enough space in your book, and then we will go with the psychiatry. It's time. Okay, any doubt? Any doubt? Done? Okay, so it's already time. So this one, psychiatric will continue tomorrow. First, we'll just solve question paper. Okay? Fine, na? We will go with the anesthesia question paper. Hope other people also joining